Hey! We've received a lot of overdue notices.
Huh?
And this one, it's their second payment request.
Oh.
You said you'd take care of this, but what have you done? We keep getting overdue notices.
So, if I said I'll take care of it, I know it's important. Maybe I forgot this one, but you forget things too.
This one is the umpteenth overdue notice. I honestly think you don't want to do anything anymore. So you forget. How practical.
So, I don't care. Well, I don't want to do anything anymore.
I get that impression.
I'm going to say something. I'm getting fed up with all your bills. You can keep them for yourself.
How long has it been since you noticed you were having difficulty remembering things?
But my memory is fine. It's my wife who wanted to consult our family doctor. And that's why he sent us here.
Mm-hmm.
Okay, my husband has been having severe problems with his memory for about a year now.
Okay.
Whatever your age, do not wait before consulting a doctor if you are experiencing memory loss. A memory screening is always helpful to patients and their families. Aging itself is not necessarily related to memory loss.
I don't know. Yes, I forget a few things, but you forget things too. It's age, really.
I suggest that we do a checkup to see how your memory's working. Would you be willing to do this?
Well, if it can help, yes, I would like to.
There's a fish among these 4 words. Which one is a fish?
The sardine.
Very good. Which one is a game?
The lottery.
Perfect. And a flower?
The daisy.
Very good. There was a fish on the page I just showed you.
No.
There was also a game?
The lottery.
Very good. And a flower?
The daisy.
A neuropsychological evaluation is often performed with a supplementary analysis of the blood or magnetic resonance imaging. The diagnosis is complete once the doctor has studied the case and analyzed the neurological examination, as well as the neuropsychological evaluation and other tests.
We see that on some of the tests you performed normally, but that on others you have difficulty remembering things. Today we're better qualified to define and diagnose your problem. You're most probably in the early stages of Alzheimer's disease.
Alzheimer's disease is a chronic illness that deteriorates our cognitive functions. In the beginning, it evolves in an insidiously subtle way. A diagnosis helps us to understand what would otherwise be incomprehensible behavior and attitudes.
What's going to happen to me now?
We will begin by proposing certain drugs, and then we also suggest that you participate in a weekly memory workshop.
Okay. Well, I'd like to. I will gladly do it because right now, I'm feeling pretty low.
Alzheimer's disease provokes a decline in cognitive functions, which creates problems in performing daily activities, such as managing one's medicine or using public transport. It progressively hinders patients from dressing themselves and eating on their own. It leads to a loss of autonomy. Such symptoms are sometimes accompanied by an alteration in behavior and humor. The patient becomes agitated, anxious, depressed, and sometimes experiences hallucinations. The loss of one's personal autonomy and independence may have devastating repercussions, not only on the patient, but also for their family and friends.
Hello, Mr. Lagrange. I'm your nurse.
Hello.
As a family member or close friend,
How did it go
you
this
need to
week?
learn to deal with this unique situation. Do not hesitate to ask for help.
How did it go this week?
Oh, rather well. On the whole, things went rather well, yeah? Yes.
The Home Aid Service allows breathing space for family and friends and helps them better care for their loved one.
Did everything go all right with the medication this week?
Oh, yes.
Yes?
Yes.
So he's taking his medicine? But yesterday noon, there's a pill left.
I had better check from now on. You must have forgotten to take one yesterday afternoon. Yes.
It is very important that the medication be
Yes.
taken regularly.
Of course, yes.
We'll start over again. I'll fill the 7-day pill box as I did last week.
Existing drug treatments help stabilize the symptoms of Alzheimer's disease. Other drugs are currently being studied, but for now, although we can slow the disease's progress, we cannot heal it. Memory needs to be cared for and worked on. It is possible to improve a patient's daily life by taking advantage of any of his or her faculties that may remain intact.
The idea is to keep this agenda, this diary, to write down important information. Here are 3 questions we should always be able to answer when we jot down an appointment to make sure that the information is correct. When and where, with whom, and why.
The re-education program may be personalized and adapted to the patient's needs. It can go on for several months in tandem with drug treatment.
Sometimes I don't look at my agenda. I forget. I don't forget the appointment, but I forget to look at my agenda.
We should develop the habit of consulting our agenda at certain moments during the day.
Specific activities are decided upon with the patient and their family. The idea is to make daily life easier. Motivation and pleasure are important elements in prolonging the patient's autonomy.
How have things gone, Mrs. Lagrange, since we last saw each other?
It's not always easy. He drives me crazy sometimes. He could be very clumsy, and he's becoming more and more dependent. And I get upset, and then I feel guilty.
You have the right attitude. You do what you can do, but you've also accepted the help we've offered.
You have more time to care for a loved one with Alzheimer's disease if you accept outside help. Little by little, you will need to learn a new way of living and adapting to the many changes in your daily life. Mr. and Mrs. Lagrange meet with a memory specialist 1 year after their first consultation.
How are things going at home?
Well, things have become rather difficult. He lost his way in the neighborhood several times, and he returned home later than expected.
Okay. Mr. Lagrange, what happens when you go out? Do you have a hard time using public transportation? I know you're used to using the bus.
I know about the new routing. I don't know what happened. The streetcar was... I think they changed some of the stops. Yeah. Well, I think so.
The neuropsychological evaluation has revealed an important reduction in the patient's performance at every level.
I'll show you another one. Your turn. No. Okay, there's no problem. We'll do something else.
Mrs. Lagrange, I would like to propose that a healthcare worker come to your home to help you in your daily activities.
Considering their daily life problems, particularly the patient's pronounced apathy, the doctor adapts the treatment and suggests that Mr. Lagrange begin visiting a day hospital.
Do you want something else?
No.
No?
With pleasure.
You see, I'm wearing wool. I had to rub my hands together to keep them warm.
Don't you have gloves?
I have gloves. It's fine. Only I always forget them.
Mr. Lagrange has breakfast with the other patients when he comes to the day hospital. Appropriate supervision and specially trained personnel ensure that care is well adapted to the evolution of each patient's disease.
Left, right. There. Swimming is hard.
Mr. Lagrange participates in group activities such as Tai Chi, a mild form of Chinese gymnastics, which is both a physical and cognitive discipline that helps patients maintain their concentration.
It's very important to move your body. Okay, now try to move your body.
This also gives Mrs. Lagrange time to take a look at her own problems. Healthcare workers are ready to listen and answer all of your
So
questions.
that there isn't a break, because then he'll forget.
Mr. Lagrange has now been hospitalized with pneumonia.
Hello, Mr. Lagrange. I'd like to introduce myself. My name's Christine. I'm your designated nurse. I'm going to take your blood pressure. There. It's going to swell, Mr. Lagrange. It's going to swell. Okay, I'll stop. I'm stopping.
New behavioral problems have arisen: restlessness, incoherent thoughts, and increased aggression towards his wife.
You know that he's here for pneumonia.
Pneumonia?
He'll have to stay with us a few more days. This is a specialized unit for patients suffering from Alzheimer's disease.
Alzheimer's disease progresses over the years and varies from person to person. However, the situation can suddenly worsen with the appearance or increase of behavioral problems, possibly due to parallel health issues which weigh heavily on the already fragile brain.
Your husband is hospitalized in a unit adapted to his particular problems, so he is well taken care of. But how is he?
Well, I think that he has a tendency to suddenly get upset and without warning becomes somewhat aggressive and...
We've spoken about this before. It's all part of what we call behavioral disorders.
Alzheimer patients must be allowed to express themselves at their own pace. You should not interrupt them. You must also avoid contradicting, criticizing, or reprimanding them.
You see? You're doing better. You'll be able to come home soon.
Your vacation is over. You're going to have to put up with me again.
Speaking of vacations, we are going to visit your sister in the south of France.
Oh,
And there we can really relax. We deserve it.
really?
Oh, yes.
You should communicate with tenderness, touching, openness, and a warm, receptive attitude.
What is this?
Adidas.
No brand names. Okay, but what does Adidas make?
A shoe.
Yes, a shoe.
A shoe.
Mr. Lagrange comes to the day centre 2 or 3 times a week. The care given here, plus the home aid, enables the couple to continue living together, even if Mr. Lagrange is no longer independent. It is extremely helpful to his wife.
I think your wife made this for us.
Huh? She's...
You certainly took your time.
I didn't see you.
You said to yourself,
Well,
wow,
not that
she's
small.
pretty.
Mr. Lagrange makes friends and reconnects with people at the day centre. It is a place where he can express himself and is adapted to his needs. An application has been made for a nursing home. The day centre offers various programs for patients like Mr. Lagrange and is, if necessary, an appropriate progressive preparation for entrance into a nursing home.
Autonomy.
Die from tate. I
Like this. There. Then you tear it. Press on it. Pull it. Pull. There. You see, it's easy. That's it. Good. Now we don't need that. I'll take this one. Can you do some more for me?
Okay.
Yes, yeah.
Communicating with people suffering from dementia is not easy. People dealing with them must constantly adapt. Dementia also affects speaking. The patient can no longer express his or her needs and is often misunderstood. Depressive or violent behavior sometimes results from this incapacity to communicate. Alzheimer's disease is extremely demanding and requires a lot of one's family and close friends. They must establish a new relationship with the person they once knew and accept that in return they may not be recognized. One should not try to go through this experience alone. A healthcare network exists to heal and to help both patients and their loved ones.